Namaskaram, good evening, and welcome everyone who's joined us on this very special webinar to try and understand the complexities of this pandemic. We have with us one of the world's leading epidemiologists to guide us through this, and on behalf of the Believers Church Medical College Hospital, it's my proud privilege to welcome my dear friend, Professor Dr. Jayaprakash Muliyil, who after his undergraduate and postgraduate studies at the Christian Medical College Vellore, went on to John Hopkins University to do a master's in public health and a PhD in epidemiology, came back to CMC Vellore, set up courses in epidemiology, which we attended, tried to understand, but forgot very quickly. But he went on to start the master's in public health and has established and was our principal at the Christian Medical College Vellore. Thank you, Dr. Jayaprakash, for joining us. Dr. Geethu Matthew is Associate Professor of Community Medicine at the Believers Church Medical College Hospital. She has been part of the Kerala state government's response to this pandemic. May I now request Geethu to start the proceedings and then request Dr. JP to start.
Thank you, George Andy, sir, Director and CEO, Believers Church Medical College Hospital. Now, as we all, COVID-19 has created a lot of panic. I think one of the burning questions in everybody's mind is about community transmission. So where are we now? Is India in community transmission stage?
Good evening. Now the word community transmission has become an expression that is kind of disowned by most people. They don't like to say it. And I don't know why it is being shunned so consistently. All it said was, this is a foreign disease. When it comes initially, it remains foreign till it establishes in the country. Establishment in the country in the sense that it can transmit on its own without any foreign visitors continuing to sustain the transmission. And the question now is, after all this blockade, no foreign travelers coming in, still the cases are increasing. And if people are reluctant to admit, then I think we have to change our terminology. I have decided in future I will not use the word community transmission. Okay, we call it a Chinese virus is spreading among us. Okay, and that is the best way to deal with this kind of situation. And what do we do about it? Now, I wanted to get you this context very clearly. Kerala has done an excellent job, and I call it a viral miracle because it is not easy by any stretch of imagination to contain the virus. Almost every country, except probably Australia and New Zealand, have managed it, but it is next to impossible. And why is it next to impossible? Because the simple reason, majority of the transmission is going through subclinical infection. And there's no way in such a circumstances you really can create a program to prevent. So I keep advising people saying, those who are in the administration, don't feel embarrassed, okay? And if it has gone into community transmission, it's not your fault. It is the virus quality and you can't help it. And most countries have accepted it and they're dealt with appropriately, and so should we. And that is important to us. So we've agreed, there's an understanding between us now, we won't keep repeating the word community transmission. The virus is still living here, happily running around, and what name you want to call it, you can call it, and there it is. So what we do now? Now I'm going to actually plan to go into the non-Kerala issue, that is most of the rest of India, where things are hotting up very, very much. Now, Gitu, do you have another question or should I continue? Because
You
we are
can
lost.
continue, sir. You can continue.
I want to take the most recent news and understand why that is very important to understand the disease. We see this happening in Delhi, Mumbai, and Chennai, and it's frightening. But what's happening in the rural area? So Indian Council of Medical Research did an excellent survey to find out what is the state of affairs in all the rural area. So you did a random sampling, and that random sampling gives us the power to estimate in the whole of rural India. So we have a sampling frame, and from there we use a technique which is very accepted and pulled out a sample. And then we tested it using a particular new test developed by, I think it is the National Institute of Virology, where my own colleague, Priya Parakat, is the director.
Correct.
And he came out with an excellent test. And this is called a test for neutralizing antibody. Okay? And this particular test, when we executed on this rural area, got 0.72% of the population in the rural area is positive for the test. What does positive mean? It means they have been infected by the virus. Number two, they also have come out of it, the virus, successfully. They are winners. And thirdly, they have excellent immunity against this disease. That is great. But the second question you have asked is, hey, is it spread all over? And that is a qualitative question. And you find, oh, it's all over. Now let's ask a quantitative question. What does the 0.7% mean? Now we are talking about a rural population, and the sampling frame is at least 50 crores. And you know what the 0.7 per thousand mean? There are 35 lakh people who are already infected by the virus and come out of it in the rural India. And Gitu, you asked a question, is there community transmission? If this is not community transmission, I think our rural India, lots of people are traveling all over the world, okay? So that must be the reason. So the issue is this amount of disease has come and it is growing. Now, when the study was done, this research pertains to an infection that happened at least 15 days prior to that testing, because this particular antibody takes some time to develop, and that means they were actually infected more than 15 days prior to the day they were tested. And then what did each of them do? They transmitted. How much transmission they did? On an average, at least 2 people they infected. And those people infected. So now how many people are infected in the rural area? Well, you can use your imagination, quite a lot. So the disease is here. Now the issue is this. What is good about the finding is a large number of showing an excellent immunity, what we call a neutralizing immunity antibody, which mean our hope that these people who have been infected are at least safe for some time. Recently, yesterday, I think, came a paper, they asked a question, how long does an antibody last? Well, these people have only got it recently. They followed up for 2 months and found for 2 months their antibody is steady. Will it last for 3 months, 6 months, 1 year? I am an optimist. Okay. After measles infection, how long does the antibody last? Oh, quite some time. So we have a good immunity for those who had exposure to the virus. Okay. Now, we have not published the data from cities or containment area where there is hotspot. And there was a leak in the newspaper, and I can talk about that. And somebody reported there was as high as 30% infection. Well, it also means that many proportion of the population what they come from are now immune to the disease. So I'm going to summarize this whole thing. Cities are galloping in, and there is mortality, which is sad. But when you feel depressed, think of the other side. There is also a large buildup of immunity, which eventually will lead to a level of herd immunity, which will stop the virus in its steps. Now, people keep telling me this particular herd immunity theory is JP's theory or JP Muliyil. It is not. I did not invent it. I learned it in school. I taught everybody that. But for some reason, just like community transmission, herd immunity was also a bad word. Okay, now all it says is the herd immunity. It is theoretical, it has been shown to happen. We saw it when H1N1 came. That immunity, when it builds up, the virus finds it difficult to transmit itself and comes down. And the R value automatically dips to what is called R is equal to 1, which is an endemic phase. And that's all it says, not my theory. It's in every book of epidemiology. You can read it. Now, because we now factor it in, what is the comfort that gives you? You don't have to wait for every one of the 136 crores Indians to get the infection. By the time about half of them are infected, the epidemic will come to a screeching halt. Okay? And then what happened? Well, at that time, things are quiet. And there won't be any transmission. And for heaven's sake, you know what's going to happen? Corona is going to be almost forgotten. Okay? Now, be careful. It can come back. But when will it come back? When the susceptible population builds up. And how do susceptible population build up in a country? Through births. New birth. That means a little time. We have maybe a year, maybe 2 years. I want to remind you that these revisits for some of the known diseases are quite exciting. Like measles used to regularly come every 3 years into the villages of Vellore. We could time it. Oh, next year is going to be the measles year. Sure enough, there it appeared. German measles used to come back every 7 years. I don't know what is going to be COVID. I hope we get a couple of years. By the time there will be vaccine, we can think clearly, we see what to do. In the meantime, I have a special news for Kerala. In Kerala, the proportion of elderly is very high. Okay? I'm going to quote an old statistic. In all over India, of all the people who die every year, and remember about 10 million people die, 50% are about the age of 60. But what about Kerala? 75% are above 60. Young mortality has come down, people live longer, that's good. But they are not good fighters of COVID. They get into trouble all the time, including me. I belong to that age group, 70 plus. So, what should you do? Your two options. One is to say, all these opportunities, if you get sick, don't come to hospital. We can't afford ICU care. Now, that is mean. Don't do that to us. You tell us something very simple. Don't get into trouble. Try to keep yourself out of the battle. For the young people, the mortality is so low. I mean, very, very low. In fact, my worry is all of us elderly people will come and block all the hospital beds. So when young people fall ill, there won't be any place for them. So that's why you have to keep these elderly people out of the battle. But once the herd immunity comes up, you know what will happen? Then elderly people can walk free. So this message I am giving you, just in case your current battle in Kerala loses and you go into community transmission, please don't blame yourself, blame government or blame the health system, because it is very, very difficult to control this kind of virus. You have done a good job. You have stood together as a team, and I'm confident you can win the battle even if there is a community transmission. You have to make sure elderly are not in the game, and I know you will devise techniques of ensuring that part also. Gitu, you can prompt me with a question, or I'll answer any other questions you have.
Yes, sir. Sir, according to you, when will this peak and when it will come down?
Yeah. What happens is the epidemic starts as a small cluster, multiple clusters, and grows into large clusters. So each part of India is in different stages of the epidemic. Now, a place where you have an transmission like in Mumbai or in Chennai, usually around 100 days. Okay, so you start from there, it started. And I see, the question is, you'll immediately ask me, so what will lockdown do?
Yeah.
Okay, theoretically, a lockdown slows the virus and the transmission comes, theoretically. But some of the scenes you see from the media, lockdown seems to stimulate more human to human contact, at least in some parts of the markets in England. I don't know. But in general, lockdown is, I am not happy with lockdown for some simple reason. Remember, the main casualty is the elderly. And you have to do a program for them separately. You have to lock them down, lock us down, yeah. But not the young people. Okay, now look at a 25-year-old person. Can he die in this COVID? According to the UK and French statistics, yeah, there's a chance. But what is the probability? It is something like 30 per 100,000. Okay, now that is lower than a road traffic accident probability, much lower. So you can't do a complete lockdown just to save some elderly people. No, I don't think so. I think you have to have a program primarily for elderly people. Okay, and an educated town as a place like Kerala can do that very successfully. The Swedish group has been trying to do that. Now, people keep comparing mortality. Don't compare mortality differently. India inherently has a lower mortality because you are a much, much younger population than any of the European countries. So overall mortality is much lower. But more important, the way the epidemic travels, when you slow down, you don't prevent any death, you only delay deaths. Okay? So you can take it slowly. There is an advantage in delaying deaths because hospital will be crowded less. But then, under that pretext, you go and lock down everybody. That doesn't work. And at the end of it, in many parts of India, I don't see any extra beds sitting there. So, you have to decide how you're going to handle it. British went in and were saying that we are not going to do anything, let the epidemic pass. But they got in trouble. Why? Because they thought their national health system had the capacity to take it, but they didn't. So, and London is a huge, huge city. So it is sometimes difficult to measure the impact. So even in India, these big cities will have big problems. What about rural area? You hardly will notice this. Okay? Small town, yeah, but big cities. So I would advise the government anywhere to go into close collaboration with the private sector. Why is that? In India, more than 80% of the healthcare is provided by the private sector, and they have been asked to keep quiet. And that is not a fair decision the government of India has made. You should actively involve them. Access to care. This is another viral disease. There are a lot of viral diseases. Okay, this is not some kind of a, and we have managed to stigmatize the whole thing because of the name you gave and the way you treat and the way you try to protect yourself. It is a viral disease, and majority of the people will walk out without any problem. Now, I am more than 70. My probability of dying from COVID, if you get infected, is about 4%. It's very high. But look at the other way around. I'll walk away from COVID, the probability is 95%. That's pretty good, right? So you have to think it positively. And there's no way of being afraid, doing any good, being confident, sensible, okay? And luckily, this disease, let me tell you one thing, has got these few qualities. It's a person-to-person disease, okay? It is a person-to-person disease. You need at least 1,000 virions and more to induce infection, because the virus doesn't know how to search a receptor site, go and find it. No, it's a pure probability of hitting a receptor site in your nose. Very chancy thing. So you need a large number. And that number is well delivered by the transmission from person to person. Okay? Even when you speak, and George Andy, even when you sing, if you're loud in a choir, that transmits, because a loud singing is almost like a continuous cough, okay? The effort you put. So those kind of things are personal, okay? Sitting close together and talking in a loud room, yeah, you tend to raise your voice, transmit. That is the person-to-person transmit. The other way around, you know, scared of somebody touching you. Oh God, did COVID catch me? Let me have a bath quickly. I mean, that is a little exaggerated response to COVID. It doesn't come that way. It comes exactly like flu. It comes exactly like measles. Okay, person to person, droplet infection. Number one. Number two, if you get it, your body is an excellently created body. His immune system is outstanding. It knows how to fight it. It produces good antibody. And from lab indications, it looks like the memory cells are stimulated. That means it will be a fairly lasting immunity. I mean, there are others who think may not last, but that is I am an optimist. And I'm going to tell you, this is going to be a fairly lasting. Even if it doesn't last, there are lots of vaccine being manufactured. Remember, an immunogenic virus is a good starting point for a virus creation, because it If the virus stimulates your immune system, a vaccine also will be able to stimulate your immune system. So things are looking bright. Over to you, Gitu.
Sir, we have been hearing about reverse quarantine concept. Could you just explain? You have already told it. Could you just explain a little more about reverse quarantine?
It's very simple. Quarantine, good old time. You come from an area where there is a disease. Even cholera used to be quarantined till you manifest. So they keep you for 2 incubation periods. Now here the problem is that the elderly should not get infected. Okay, and they are small in number. In India, this above 60 age group is only 8.5%. I don't remember what it is, Kerala, you may not remember, but I forgot. But still a minority. So what you do is, you keep them in the secure period. Encourage them, even in the house, when the others are around, wear a mask. Okay, the idea is, the youngsters may carry the virus, but you don't allow the senior citizen to get infected. And that has to be done according to the social status. I know people kept arguing with me, how can you do it in a slum area? You can't. Agreed. But are there areas where you can do it? Can you protect 75% of the elderly? And you try to figure out how you'll do. And remember, it's a person-to-person transmission. So the distance and mask and hand washing will go a long way.
Sir, there are doubts from the public regarding the route of transmission of this virus. So can you just explain 2 minutes regarding the route of transmission?
The route of transmission, I told you, you need to have an adequate dose. If you get, see, theoretically, one virus can cause the infection. See, it's like this, to have a pregnancy, you need at least 1 spermatozoa. But that probability is extremely low. So God has created a system by which we have millions of spermatozoa. That is the probability game. So virus, unless there are many, it's a chance that it'll find a place to go in, the receptor side to get in, is very low. So I'm not worried about somebody touched you or, like for example, people are all washing vegetables, right? George Andy will be happy, he's a gastroenterologist, so that, washing vegetables prevent diarrhea. I agree with that. At COVID, I doubt very much. Okay, what is it? You have to wash your hands. Yes, because you might have come to contact. So when you come back, bath is always good. Kerala is taking bath. For every excuse, there is a bath. So it doesn't matter. You can do that. I'm not denying that. So, but the point is, don't forget the most important thing. When you fail, see, look at the way the doctors, at least I know CMC Vellore. Patients come, they talk to them, they're all COVID suspect. These guys are not scared. They're sitting there and seeing them. And, triaging them, taking care of them. Can they get infected? Well, there's a slow probability. But if you're adequately protecting yourself, you're okay. There's a chance we take. Only thing is, I won't like senior citizens going and looking after this sort of activity, because even if you slip up and you get infected, the probability that you will walk away from the COVID is extremely high if you are. So many of the things that we try to do to protect ourselves. Somebody asked me the question, if you keep washing your hands, will your immunity improve? No. If you keep washing your hands, you'll have very clean hands.
JP, I have 2 questions. How did New Zealand manage what it did? And secondly, in Beijing, there's a second wave. Can you explain these 2 for us?
Okay. Now, the New Zealand story is very interesting. Remember, it's an island, and they entered the game very early, just like Kerala. Okay, so we moved in very early, And they did a very clever thing. Told everybody, listen, we are going to get rid of the disease. They went into a lockdown. One, people got ready, they bought their stuff, they knew how they are going to stay inside the house, and they practically stayed inside the house. There was no human-to-human contact. It's not easy, okay? An orangutan population can do it. Each one will sit on a tree and look at each other, won't get anywhere close. But human being in India, it is not possible. But they did it, okay? And as a consequence, with that zeal they were able to get rid of that disease completely. Theoretically possible anywhere, but that required a lot of effort. But they got in extremely early. Each infection that comes from above is a seedling. And you have to pull out every seedling and throw them out or kill them. And that requires a very, very concerted effort. It's not easy. A small country, highly educated country, well-to-do country, they could afford themselves to lock down for some time. All that put together, it worked. For our people, daily wage earner is not correct. Number two is your question in China. China has always been a mysterious country, okay? And I don't know what happened, but I'll tell you what will happen. This is a little theoretical. We go by a figure called R0, which is calculated at the beginning of the epidemic, when everybody is immunologically naive and nobody is doing anything. Nobody is wearing a mask. George, you want to say something? No. Nobody is doing anything. There is an exposure level that is created by your activity. And that is what called R0. That is, you are attending weddings, you are going for parties, and living in that style. What is the transmission capacity in that phase? That is, with IPL, not without IPL. You are meeting everybody. At that level, what is the transmission rate? That is what R0 gives you. Now, what happens is, as your immunity builds up in the community, the R effective starts dropping till it comes to 1. You could actually drop the R effective to 1 or even below 1 temporarily by locking down everybody, or everybody is careful. You're not getting infected. The problem is that is an unstable state. There's an unstable state in the sense that the moment you open up, it'll come back again. And that is the problem with that artificial thing. So I don't know if the way I'll read it, if there is a second wave coming early, the only possible reason can be that their R effective was brought down artificially, okay, and consequently there is no immunity level in the community which could stop a re-entry of the virus in full scale.
Maybe 2 questions from people who are writing to us. One, when do you think we will peak? When do you think it will end? Sorry for asking you this, but whatever you believe, tell us, please.
Each locality.
Go ahead.
Something is going wrong, I think.
Yeah, we can hear you. Go ahead.
Okay, can you hear me?
Yes, Jip. Yes.
I think, Tanya?
We can hear you clearly.
Okay.
Go ahead.
Remember, India is a large country. Okay, it's very unfair to ask me about the huge, it's a multiple country.
Sorry about that.
So you have to remember, it is even in, let's take Chennai, for example. Some clusters are reaching herd immunity. Some localities are reaching herd immunity. They reach the peak, come down. Okay? I don't know Dharavi very well, but I know that the infection rate must be very high. And that will be one of the places that will peak first. Okay, so areas where there's high infection rate peaks first. And then these little clusters merge, and finally you'll find Chennai is completely, or Tamil Nadu, whatever. Like Vellore is delayed. We will have to wait longer. So one date not available. It'll be multiple. Okay, but one thing is there. When the big cities are finished, there will be a calm in the country. We can at least think of something other than COVID.
Sir, there is another question from public. We have heard that there are a lot of strains for coronavirus. So is reinfection possible? And in that scenario, is vaccine effective?
Now, an RNA virus, which is COVID's group, RNA, for example, measles virus, a DNA virus, very stable. Influenza is an RNA virus. It's very unstable. So every 2 or 3 years, you will get a new strain. But fortunately, this COVID-19 is much more stable than the influenza virus. Okay, structurally, it is more stable. And there's also one other reason, at least some authors believe, that it seems to produce more than one kind of neutralizing antibody. Okay, so we have kind of a double protection. So I think if a new virus emerging will be delayed, which causes a serious problem. That is my understanding. I'm neither a virologist nor an immunologist. Okay, I'm with you. So your information may be better than mine.
So do you think that there will be difficulty in developing herd immunity in this scenario with more serotypes of virus?
No, each virus, when it comes as a new type, new serotype, it's a new virus. Okay, so you have to start all over again, building up. But then there's an advantage. I told you, it is not likely to occur in the near future because of the good immunity that it gives, number one. It is much more stable than the virus, that is the influenza virus. So if it happens, we have to face that.
So what are the future strategies we can take? Now we have to live with the virus, as you mentioned before. So what are the different strategies we can take to live with the virus in future?
To do what to the virus?
To live with the virus. Live with the
Live
virus.
with the virus. Yeah, they've been asking this question. Do you get up in the morning and think of H1N1?
No, sir.
No. I'll tell you one thing. We have a huge number of viruses and we are a battleground anyway. You got encephalitis, dengue, chikungunya. All right. So when it's in the news, when large, with a cluster effect is big, so it is magnified and then we all focus on. And so I don't think it will be bothering her. Okay. Now, I think the virus will have to manage on its own. We are not going to be worried about it. Okay.
Sir, one more question from the public. Is social distancing effective? Or transport or travel in a public transport, how effective is it? How risky it is?
The word social distancing is an unfortunate term. Okay. A social distancing is sort of includes, don't smile, don't say. No. I say keep to physical distance. In that context, yes, there's a problem with our crowded buses. In fact, the main impact of our lockdown on the transmission dynamics, which we experienced initially, temporarily, was because our transportation came down and crowding came down with it. But that also is a transient effect because then it becomes a new level and again the epidemic continues. You understand? And R naught of 2.4 will come down to R naught of 2 and then it goes on. So that is not a permanent solution. So we have a problem. In the absence of an early vaccine, We have to accept that. See, for example, now there is a short lockdown, they say. I don't know how effective it is going to be. I think you have to remember that there is no option but let the virus do its work. There is no option. You should remember, we always think man is superior, man can control everything. But in this situation, we can't. That's what happened. So if I knew a trick, I would have told you. And I don't know. We are stuck with this. Remember, when we used to have measles back where viruses to come, what did we do? Did we lock down? No, it infected children. Remember, not elderly, children. We lost children. And then the vaccine came. What a relief. And I'm also looking forward to the vaccine. But for the time being, we have no such luck. And only thing we can do is mess up our whole economy and the other healthcare strides we have made in immunization. And all of that will be lost if you go on locking yourself down and hide from the virus. That hiding is temporary. The virus will eventually catch you. So might as well face it head on. I'm not saying take off the mask, okay? I'm saying be sensible, live, but live and work and be productive. India's solution is rise in being productive, especially those below the age of retirement.
Sir, we have been hearing a lot about the prophylaxis with HCQ. So what's your opinion on that?
I am again not a pharmacologist, okay, but I read articles. I will tell you there are two new studies which has come. One is a study on patients and other is a study on prophylaxis. The patient study did not show any difference. This is I'm ignoring the Lancet scandal and things like that. This is the newest study. About 1,500 subjects were involved, reasonably well done. Didn't come out anything concrete. That is in terms of curative effect. The more imaginative study was whether it can prevent, because that is important from healthcare workers' point of view. What they did was they took people who had a reasonably stable exposure. That is, 10 minutes, spoke to a guy without a mask, and turned out the other guy was positive. And that is an exposure, talking 10 minutes to somebody. So they gathered the people like that all over the US and then randomized them into group, hydroxychloroquine versus placebo. And then try to see how many of them developed COVID-like symptoms and did anybody test positive subsequently. So their hope was hydroxychloroquine will at least offer 50% protection. But when you looked at symptomatology over the, this is all done through the mail, there were no difference between the two groups in the expected period, nor in the number tested subsequently positive in the two groups. So that's all I know. So there was a hope that this could work, but the problem is there's no evidence currently urging us to use it.
Dr. JP, can I just ask you two questions? There are some reports that say when we are together in a room, even with social distancing, physical distancing, you are more likely to get the infection. Is that right? Even with all the masks and everything?
Yeah, more likely as compared to what? More likely as compared to no meeting. I agree with that. But the absolute risk is very low. You understand? So in a meeting, the chant, somebody sneezes, somebody coughs. Let me tell you, every time you speak, you throw out about 20 virions. Every time you sneeze, you throw out 20,000 virions. Okay, so you can't say, please come and sit in the meeting, don't sneeze. You can't do that. So there is a little risk in gatherings, and I think that we have to accept. So that, but if you say even with social distancing and mask, is there a chance? Then you should say as compared to what? As compared to sitting at home? Yeah, maybe. But the real risk is very low. In fact, the study I just described, these people who had a personal contact, and you know what percentage actually had later on turned out positive for virus? 1%. So there's only a small risk. There is a risk.
If one other question, we in India are exposed to a whole lot of other infections. So epidemiologically, and be the BCG, does that give us some protection?
Well, the brilliant part of our defense system is extremely specific. Okay? Very specific. Each virus we produce immunity. And that is nice. Okay? Now remember one thing. IgG level on the whole, India's level as well as the Western level is almost same. The immunity involves two parts, upregulation and downregulation. Our body is very, very, conserves energy. So if an antibody is not required, it downregulates it. So we know human beings do carry other coronaviruses. If you are asking, did the experience with other coronavirus make the defense in this case easier? That's a tricky question. You're asking the question, is it because we have some sort of interference, okay, with the other virus? I don't know. At the present time, we don't have any special status, okay? We are just like anybody else in the world, and we can't trust or put our trust saying that because we lived in dirt and got exposed to a lot of bug, we are really veterans, we'll fight anything. And that logic doesn't seem to work. It is because this particular immune system is very specific. It works per virus. For example, we had 3 polio viruses. Every one of them body produced a different antibody. Was there a little interaction or possible, but not very great. You would like to have specific antibody. It is made, brilliantly made, so why not?
So there is a question from public. There is a case of nurse getting reinfected with another virus, and the nurse died. So there is a question from public. Is corona behaving like dengue virus? What's your take on it?
This other virus is what virus, do you know? He got COVID and then he had another viral fever. Is that what you're...
No, there is a news that this is a question from public. There is a news that nurse got infected first with coronavirus, then again reinfected with coronavirus, and she died.
I have not heard that. The problem with the coronavirus is we had a very poor, low sensitive test in the beginning. But now our corona testing kit is so sensitive. Sometimes they continue to give you positive even after 46 days after the initial identification. So I would like to go into the case because we have looked at the world, searched all over of a recurrence occurring. Now remember, under the sky, anything is possible. But what is comforting is most people do produce. Most people do produce in neutralizing antibody. And even those who don't produce, I think the issue is not that they are not producing. That is that our tests are not sensitive enough to pick it up.
JP, one last question. People who would like to come to the hospitals now, those who have diabetes and hypertension and chronic diseases, is it safe for them to go to hospital? What are the precautions you would advise?
Now, this is a Kerala specific question.
No, all over the country, people are worried, and some of them are getting sicker and sicker, staying indoors, staying at home. Not they're worried about coming to hospital.
It's actually a very, very tough question. Um, and I think the person to answer that could be, I can see Sheshadri sitting here, and he would be the best person to answer. Shesh, do you have a mic with you? No. You can unmute? No, you can't unmute. Sorry, no. No, I have a problem. The thing is, no, you can't unmute. Sorry. The thing is, the answer to that question is, I remember long ago asking my class a question. When you die, how would you like to die? So they said, sir, sudden death, acute heart attack, okay, glorified. I said, how about cholera? Oh, so no cholera. Why not? It's easy to take your body away because your weight will be much less. But that is a kind of a status about. I say there are a lot of other things people die of. I told you, India, we lose 10 million people. And doctors have been working hard trying to save them. What happened to all that? Now you have said, don't worry, COVID is the only disease India has. That's ridiculous. And I think I would go and say, please open up the clinic. Okay? What do you call COVID mania has to come down. Okay? And that's why you should tell everybody, don't worry about COVID, it's the old people's disease. They need to die sometime. So leave them alone. Okay? Young people are pretty safe. You can face it sensibly.
So thank you, sir. I think it was a wonderful session. We all have learned a lot from you. Even public have learned a lot from you, sir. So thank you. Over to GC, sir.
JP, thank you very, very much. On behalf of all of us who've been listening, we're very grateful. There are lots more questions coming, and maybe we might invite you once again. I hope you'll be willing to come on line with us so that we can keep talking. It's such a wonderful experience just listening to your stories. So when we are ready to ask more questions, I hope you'll come and tell us more stories. Dr. Muliyil, on behalf of all of us, on behalf of Believers Church Medical College Hospital, thank you very, very much.
Thank you, sir.
Thank you.